We weren't expecting this, but this is what happened this morning, and we found that our contracts have been terminated. We would really like to say to the Department of Health, we plead with you to treat this as the crisis that we know it is.
To be clear, there's no opportunity here for you guys to even, reason with the organization or to try and say, please hear us. Is that it from the letters you received, that it's final?
Yes. At this moment, we have no appeal. We also have had to retrench most of our staff, almost 3,000 people. It's a huge number of healthcare workers.
Guys, somehow, I knew that this was just what the plan would be for South Africa. And, it's actually really strange that the whole thing with the 90-day pause of USAID would then be put on back by the regime of Donald Trump, which we really know very well. And so these doctors from, I think this is Anova Health Center or something like that, and also the Desmond Tutu Foundation, they've been at the front line of creating programs associated with, USAID, HIV program and all of that. She's actually arguing that they woke up, I think yesterday morning, and they received a letter. I think this letter was a really strange letter that actually just said that, their contract had been terminated. In fact, this is how the letter read from a Daily Maverick article. It says, immediately cease all activities, terminate all sub-awards and contracts, and avoid incurring any additional obligations chargeable to the award beyond those unavailable costs associated with the termination notice. Immediately provide similar instructions to all sub-recipients and contractors. That's how the letter was, it sounded so vociferous, you see. And to be someone at the receiving end, receiving this letter, kind of like, this is at the end of one's, source of living, you see. This whole USAID thing, it's really crazy. And we know that PEPFAR now, South Africa, I think in my last video, South Africa is home to, I think, a quarter of the world's population who live with HIV/AIDS. So of the world's population of HIV positive people, 1/4 of that live in South Africa. With all the challenges I've been noting that South Africa has, we actually now we are compounded now with 1/4 of all of these people in South Africa that have been supported by PEPFAR funding for many years. But yesterday morning, the USAID, the regime of Donald Trump, has decided to cut it off indefinitely. And this is now confirmed. Let's quickly listen to these two doctors narrate the impact of the cuts of the USAID's funding to South Africa, that in a letter that they received yesterday saying that their contracts have been withdrawn or have been actually terminated. And I'll be back for a short analysis.
With you, Dr. Rees, didn't President Trump give you guys 90 days while this funding is being reviewed? I thought that was going to lapse somewhere in April.
Well, we've been facing a lot of uncertainty over the past few weeks. We've just been dealing with things as they arise. We weren't expecting this, but this is what happened this morning, and we found that our contracts have been terminated.
Yeah. And Professor Becker, so you guys just woke up to these letters this morning that were sent overnight telling you guys that these grants have ended permanently and with no plan of action. There's no opportunity for you guys to even appeal the decision. It's just informing you of what decision has been taken.
That's exactly right, Clement. In addition, I must say that we've also heard that our program officers, our grant agreement officers have all left the office in the States. So we haven't really known who we could appeal to over the last week to 10 days. At this, it's become clear that there really is nobody on the other end of an email to discuss this with.
Yeah. Dr. Rees, what are the consequences of this decision?
They are so far wide-ranging across many aspects of South Africa's HIV response. So implementing partners like Anova, what we do is we provide support to the South African Department of Health to deliver the services that they need to deliver. We have an amazing antiretroviral therapy program because it is the biggest in the world, and it takes a lot of collaboration and support to build a program like that. Removing 17% of the resources from a program like that through a cliff dive is essentially what has happened, and that impacts the system on so many different levels. We're facing a crisis of resources, of skills, of human resources within our primary healthcare clinics, where the Department of Health staff, who are already overstrained, they're already facing all kinds of challenges in their working environments, are now having to take on work that they weren't expecting to take on last month. And so each person's load has grown. Unfortunately, that means that for the clients and for the health users, access decreases, waiting times are longer, they're going to struggle to get their medication as quickly as they need to. So it essentially has a knock-on effect to the client, and particularly to vulnerable clients, people who can't afford to travel to the clinic, for example. Those are the people that are really going to struggle while this transition is happening.
Yeah, and for the Desmond Tutu Health Foundation, Prof, what consequences are we looking at here?
Yeah, well, you know, we have been in this fight for 30-odd years, so we are all very concerned about our HIV response, from treatment, prevention, care of orphans and vulnerable children, the prevention of vertical transmission. All of these aspects, I think, are under threat because of this, as Dr. Rees has said, this kind of cliff dive of a loss of resources. But we are a recipient of the research and development component of USAID. And we had a grant just given to a large group of us, a consortium involving 8 countries, but South Africa was holding the prime for the grant to work on an HIV vaccine that would be relevant, affordable, and useful for Africa and beyond. And we had just completed 1 year very successfully of the grant. We had 3 clinical trials lined up, and our grant suddenly ended last night. This is not the only type of grant like this. There is other important research that was underway in our country and in other countries in this region, looking at pre-exposure prophylaxis and other innovation, and these too were also stopped, including clinical trials actually in the midst of their enrollment.
Dr. Rees, if I'm not mistaken, I think was it in early February, USAID funded projects in South Africa were asked to apply for the 90-day limit waivers. When you guys submitted those, was there ever any response from the organizations?
Not really. By the time that we submitted those, we knew that the vast majority of USAID employees in the US and in South Africa had been put on leave, essentially terminated. And so as much as we applied for that waiver and we really hoped to be able to get the waiver, we also suspected that even if we did get a waiver, that the payment systems had been broken, the systems of communication had been broken. USAID was really, really heavily hit. And so they didn't have the infrastructure to actually implement that waiver.
Yeah, and have you heard from the Department of Health? What are they saying? My understanding is that this hasn't been officially communicated to them, but are they saying anything to you as organizations that have relied on this funding?
Yeah, I mean, they are planning, and we would really like to say to the Department of Health, we plead with you to treat this as the crisis that we know it is, and work with us, because we are here and we care desperately about this program. We desperately want, and by we I mean implementing partners, civil society. We desperately want to keep this program where it is and not lose ground. We desperately want to continue to grow the program and get those 1.1 million people onto treatment. So we are pleading with the department to please engage with us. When you're making your crisis plans, We have been at the coalface of this response, and we can contribute.
Yeah, and Prof, what interventions do you think can come from government? Because during the State of the Nation address, the President announced that there will be interventions if this funding is indeed cut. What kind of interventions do you expect? Because we're dealing with government here that also really doesn't have money.
Yeah, I hear that, and that's a concern. I have also heard an earlier clip and agree with it that we have to move towards self-reliance, particularly for our care, treatment, and prevention programs. But I can also see that we have the potential for a big gap whilst those resources are mobilized, perhaps. And whilst, this has been so sudden, there's been no transition at all. One obviously appeals still to the donor, world to say, is there a possibility of some reprieve while we do organize ourselves? But at the same time, I'm hoping, as Dr. Rees has suggested here, can we get together and try and formulate a plan together with government, with the ministries of health, with other NGOs. I heard the Treatment Action Campaign passionately saying this afternoon, we are ready to come to the party to say, how can we try and fill the gaps or at least bridge this immediate crisis in whatever way? So I think this is what we want to do in the first instance so people don't fall through the cracks. As far as research goes, there is no question that Africa, has to make more of a contribution to the important clinical research that is required on the continent to face some of our public health challenges. And this is a request for 2% of the GDP to go towards clinical research. This was done at Abuja. And again, we appeal, if possible, that down the pike, our governments can find a way to meet these requirements.
Yeah, and Dr. Rees, to be clear, there's no opportunity here for you guys to even, reason with the organization or to try and say, please hear us. Is that it from the letters you received, that it's final?
Yes. We don't know what's going to happen in the future. There's still a lot of legal battles going on in the US. There's still a lot of uncertainty about how it will all play out. But at this moment, we have no appeal. We also have had to retrench most of our staff, almost 300 people, 3,000 people. It's a huge number of healthcare workers dedicated. They've been consistently providing services to our communities, but we've had to retrench them because the money is not coming in. So even if money did come back, the waste has just been incredible. The destruction has been incredible already. Even if some money did come back to help us close out, to help us transition, which would be the ideal situation, it would still be incredibly difficult. And these people still have been sitting without jobs for months.
Yeah, sure. Thank you so much for coming through to speak to us, Professor Linda Gale Becker and Dr. Kate Rees, and all the best as you face this.
With these doctors who are actually at the front lines of creating programs for USAID. But what has USAID been supporting in South Africa, but also in the wider world? For South Africa, USAID has been supporting, the impacts now include that now that it's going to be cut off, there's going to be a loss of data capturers at the public health facilities. There's going to be a minimal HIV screening for children in maternal and child services. So this is actually the children whose mothers had been HIV positive. The children were actually undergoing HIV screenings as often as possible to ensure this transmission from mother to child doesn't take place. That's going to be now minimal. It says that there will be limited support now for advanced HIV disease services, which serve high risk patients, such as pregnant women. That support is going to be gone. It says that there's going to be a potential loss of pre-exposure prophylaxis services for adolescent girls, young women, and pregnant women who will be cut off from critical HIV prevention tools. All right, and coupled this with SASA, the fact that these young women actually also get support from SASA, taking the support they get from, this says pre-exposure prophylaxis services, that's actually almost going to be disappearing, as a result of this USAID cut. And all of that. So it says that there would be a loss of mobilization for HIV testing. All right. So we know that South Africa has already a really high number of people living with HIV and AIDS. I think the USAID funding used to provide mobilization for HIV testing. Now that that's gone, bro, I think this is going to be something that would be risky if the whole thing with HIV testing and all that would be the mobilization, especially for. Yeah, so you could hear from them, guys, and it's quite unfortunate because one of the things they try to argue for is that they're arguing that the likes of the health minister, Aaron Motsoaledi, should treat this crisis as a threat, which it is. All right, I think I saw a video the other day in Soweto. The Minister of Health said there was a launch of AIDS program, so to speak, and all of that. I really don't know how that funding was supposed to manage that. But anyway, this doctor now, especially this one from Anova, she's actually pushing that the health minister considers this threat, this crisis as a crisis, this USAID cut, because it's a really serious one to lose, even though President Ramaphosa said that the whole thing with PEPFAR only supports 17% of the aid support South Africa receives. If you listen to Ramaphosa clearly, he argues that 77 to the tune of $74 billion is actually being invested in South Africa by US businesses. All right, I really hope that one wouldn't be the next to go, especially now with the fact that, I said in my last video that South Africa wants to fine Google to the tune of I think the guy who does this show, Dan Walker or something. Anyway, he covered the right amount. I'll be doing a video on that anyway. That they want to find Google. South Africa wants to find Google to the tune of some million rand for the fact that people have stopped watching the likes of SABC, these news channels on the media, traditional media, and have now moved to internet services on online, YouTube and all of that. And so this is actually affecting the compensation. So they want a reasonable compensation. I'm really hoping that Google doesn't decide to cut off its services, or probably, I don't know. I really hope that there won't be a harsh decision from Google, knowing fully well that Google is actually situated also in the US. It's just quite sad for me if I reflect about these whole issues on how much power some of our economies have given to the US, because we have decided not to stand up for ourselves and our people and build. Rather, we've allowed corruption to engulf almost all of our economy. South Africa is not alone. Even in Nigeria, most of the citizens, you see them complaining every day about corruption, that the leaders do not care about them and all of that. So it's so sad that we've had to have so much dependency on another country. And this is not just country that the US isn't just printing all this money from thin air. This is the hard work of citizens. They work really hard and pay taxes, and all of those taxes to the tune of billions of dollars supporting other countries. And somehow our own leaders really have sort of like relaxed, taking all of that money, possible sometimes, to private pockets. We do not see the impact of these programs. We do not see the impact of these funds in our societies. Our societies keep getting poorer and poorer. And it just makes you wonder, what kind of a mess is all of this? And I think that's where South Africa is today. Really unfortunate, especially with the cutting of PEPFAR. I suspect that AGOA will be next. This is not conspiracy theory now, and I'm not trying to be negative, but I just really suspect there's something telling me that Donald Trump might not renew South Africa's requirement for entry into AGOA. And if that really happens, bro, I don't even want to go there. But share your thoughts. What do you think about this video? PEPFAR cuts in South Africa, indefinite suspension of contracts by USAID workers. I don't think PEPFAR will be coming back to South Africa. Share your thoughts in the comments.